Tom underwent an open heart surgery. Towards the end of the operation, the anesthetic started to wear off. Although he wasn't able to feel the physical pain, he did regain the consciousness. When they cleaned and stitched him up, Tom didn't experience pain but was overwhelmed by the feeling of helplessness, and he was unable to move or let the medical staff know that he had become conscious. The experience left him traumatized. His sleep was severely disturbed with repeated flashback of the alarming wake-up during surgery. His blood pressure remained high. He was agitated and irritated. Tom was diagnosed with PTSD, post-traumatic stress disorder. It is a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it. Types. Normal stress response. It is what occurs before the PTSD begins. However, it does not always lead up to the full-blown disorder. Events like accidents, injuries, illnesses, surgeries, and other sources of unreasonable amount of tension and stress can lead to this response. Acute stress disorder. While not the same as PTSD, natural disaster, loss of loved ones, loss of a job, or risk of death all are stressors that can trigger acute stress disorder. If left untreated, acute stress disorder may actually develop into PTSD. Uncomplicated PTSD. It is linked to one major traumatic event and is easiest form of PTSD to treat. Complex PTSD. It is the opposite of uncomplicated PTSD, that it is caused by multiple traumatic events, not just one. Complex PTSD is common in abuse or domestic violence cases, repeated exposure to war, or community violence or sudden loss. Comorbid PTSD. It is a blanket term for co-occurring disorders. It is applied when a person has more than one mental health concern, often coupled with substance abuse issues. Symptoms. Reliving. People with PTSD repeatedly relive the ordeal through thoughts and memories of the trauma. This may include flashbacks, hallucinations, and nightmares. They also may feel great distress when certain things remind them of the trauma, like the anniversary date of the event. Avoiding. The person may avoid people, places, thoughts, or situations that may remind them of the trauma. This can lead to feelings of detachment and isolation from family, friends, as well as a loss of interest in activities that the person once enjoyed. Increased arousal. These include excessive emotions, problems relating to others, including feeling or showing affection, difficulty falling or staying asleep, irritability, outburst of anger, difficulty concentrating, and being jumpy or easily startled. The person may also suffer physical symptoms such as increased blood pressure and heart rate, rapid breathing, muscle tension, nausea, and diarrhea. Negative cognitions and mood. This refers to thoughts and feelings related to blame, estrangement, and memories of the traumatic event. Causes. Trauma. It is a term used to describe a deeply distressing or disturbing event. This can be an isolated incident such as a car accident or ongoing like exposure to a domestic violence. Abuse can be physical, sexual, or emotional abuse. It can happen in childhood or adulthood. Abuse can also be witnessed, such as seeing a loved one being abused. Medical procedures. It can be traumatic for some people, such as surgery or a biopsy. Diagnosis of a life-threatening illness. It can also be traumatic. These includes conditions like cancer, HIV/AIDS, and multiple sclerosis. Sometimes just knowing that someone you love is sick can be enough to trigger the disorder. Genetics. If you have a family member with PTSD, you may be more likely to develop the disorder yourself. Brain chemistry. It is possible that an imbalance of brain chemicals plays a role in PTSD. Brain imaging studies have shown that the brains of people with PTSD look different than the brains of people without the disorder. Stress. When you are constantly under stress, it can take a toll on your mental and physical health. Chronic stress can make you more susceptible to developing PTSD. Pregnancy and childbirth. If you have had a difficult pregnancy or delivery, you may be at risk of developing PTSD. Some studies have even found that women who have had multiple miscarriages are at an increased risk of the disorder. Diagnosis. Physical examination. It is to check for medical problems that could be contributing to or causing symptoms, to rule out the other medical conditions. Psychological evaluation. It allows to openly discuss with your healthcare provider some of the events that have led to you experiencing these symptoms. During the evaluation, you would share with the healthcare provider signs and symptoms you are experiencing, as well as the duration and level of the intensity of the symptoms. Use of DSM-5 criteria. There are specific requirements that must be met for a diagnosis of PTSD. It is specified in DSM-5. PTSD is diagnosed if the person has symptoms of PTSD that last for more than 1 month. If it is less than 1 month, then it comes under acute stress disorder. Management. Psychotherapy. Cognitive therapy. This type of therapy helps you recognize the ways of thinking that are keeping you stuck. For example, negative beliefs about yourself and the risk of traumatic things happening again. Exposure therapy. This behavioral therapy helps you safely face both situations and memories that you find frightening so that you can learn to cope with them effectively. Exposure therapy can be particularly helpful for flashbacks and nightmares. Eye movement desensitization and reprocessing (EMDR). It combines exposure therapy with a series of guided eye movements that help you process traumatic memories and change how you react to them. Medication. Antidepressants. These medications can help symptoms of depression and anxiety. They can also help improve the sleep problems and concentration. Anti-anxiety medications. These drugs can relieve severe anxiety and related problems. Ways to cope with PTSD. Follow your treatment plan. Remind yourself that it takes time. Following your treatment plan and routinely communicating with your mental health professional will help move you forward. Learn about PTSD. This knowledge can help you understand what you are feeling, and then you can develop coping strategies to help you respond effectively. Take care of yourself. Get enough rest, eat a healthy diet, exercise, and take time to relax. Try to reduce or avoid caffeine and nicotine, which can worsen the anxiety. Don't self-medicate. Turning to alcohol or drugs to numb your feelings isn't healthy. Even though it may be a tempting way to cope, it can lead to more problems down the road, interfere with effective treatments, and prevent real healing. Break the cycle. When you feel anxious, take a brisk walk, or jump into a hobby to refocus. Stay connected. Spend time with supportive and caring people, family, friends, faith leaders, or others. You don't have to talk about what happened if you don't want to. Sharing time with loved ones can offer healing and comfort. Yoga. Yoga typically combines physical postures, breathing techniques, meditation, and relaxation. Yoga has been shown to reduce physiological arousal in PTSD patients and is believed to affect the pathology of PTSD by improving somatic regulation and body awareness, which are imperative to emotion regulation. So this is all about regarding the PTSD. Hope you like this video. Please subscribe the channel for more videos on related topics. Thank you and keep smiling.